Hi everyone, today we're going to be talking about early childhood mental health, specifically from birth to about 5 years of age. We're going to cover signs and symptoms, as well as why intervention is so important, how strong relationships and social/emotional development can shape a child's mental health for life. So, a couple of early signs and symptoms that we might see from children ages from newborn to 5 are excessive crying and irritability. They may have trouble sleeping, eating, forming bonds like with their caregivers, like their mom, their dad, anything. They may be aggressive or overly clingy. They also might have developmental delays like in their speech or just movements. Um, And another one that's common in children over the age of 4 is regressing. So if they're already potty trained, they might regress back and suddenly start having accidents. And these come from different challenges like anxiety or autism and other trauma responses in younger kids. So, this is why intervention is so important from the beginning, even from birth. And in the first 5 years of their life, it's kind of a critical window for development. And having this early support can help those children catch up on delays and reduce the long term effects of mental health issues. So, it's important for families to be there for their children and intervene as early as possible. And a couple of these methods for intervention can be services, like there are state funded services for infants and toddlers with developmental delays, whether it's speech or mobility development. There's also parent and child interaction therapy, which is it helps the parent and the child build a stronger emotional and positive connection with each other through structured coaching. There's also infant mental health therapy, and it basically focuses more on the child and the bond that they have with their caregiver, whether it's neglect, like cases of neglect, it can sort of help those children out. Additionally, there's applied behavior analysis or ABA for children with autism, and it teaches children the desired behaviors versus the more undesired ones and helps them not to act out. So, the power of healthy attachments is kind of it teaches the children to be able to trust and build healthy relationships as they go on throughout their life. Because the kids are in this critical developmental window, it's important to teach like the healthy habits now so that they're able to learn and grow from them and they start using these as habits. When when a caregiver is always there, constantly responsive and comforting, it creates more of a secure feeling for a child and it gives them confidence to sort of grow and develop more as a person. And it's really important to start early in life because it helps the kids develop empathy for other people, manage their frustration better, be able to problem solve, and just overall being able to identify and express your own emotions. So with these skills, kids are most likely to face less developmental difficulties as they grow and therefore have better mental health. So, common mental health disorders we might see in younger children between the ages of infantry to 5 can be autism, ADHD, anxiety, depression, reactive attachment disorder, which is difficulty forming emotional bonds due to neglect. We also might see ODD, which is oppositional defiant disorder, just kind of like frequent anger and an overall defiance and resistance to authority, like their parents. And they might also have sensory processing disorder, which is over or underreacting to certain stimuli, like flickering lights and all of that. So all of these conditions are pretty different from each other, but the main thing that we get from this is just to be able to act early and build these healthy and supportive caregiver child relationships so that they have that emotional support from birth, and understanding that mental health disorders, they can start from an early age, but it's most important to be able to help and be there for your child so that they have it easier. Thank you for joining me on this um, important conversation on early childhood mental health. And